stroke ready and diaphoretic, short of breath. COVID-19 screen is positive. Over.
There are still the emergencies now.
559, copy.
The inevitable wrenching calls that end the way you might expect, with a panicked, terrifying trip to the hospital. But this is not about that.
Hi, it's Stephanie calling from the Community Paramedic Program. How are you? You're waiting for me? Perfect. Because I'm coming out.
This is about a COVID-era experiment with paramedics.
Hello? Hello? I've got some friends with me today. Is that okay? We're all in masks. Oh, look at you with the heat pad on your arm. How are you feeling?
And this possibly is a peek into the future.
We're doing methotrexate today? Yeah. Okay, and your blood work.
Paramedic house calls for those who can't see family doctors now and don't need or want an ER.
You're not feeling like dizzy or no new cough, shortness of breath?
Bored.
Everything in its...
Is that a sickness, bored?
You know what? It's hard right now, right? It's like so difficult. Everybody's kind of facing the same stuff.
Renfrew County paramedic Stephanie Rose filmed by her colleague taking a little blood, administering a shot for Annette.
When I saw that, and I thought, well, you know, how nice is that? You don't have to go and sit in the emerge for 4 hours.
Right? For something that can be fixed pretty quickly.
Can be fixed at home, and you're so more comfortable at home instead of laying on a stretcher for hours.
We will get out of your hair.
Okay.
Community paramedics countrywide have long done outreach work a bit like this. But when COVID started its march around the globe, Renfrew County's chief paramedic, Mike Nolan, started thinking bigger. What if there was a better way to deliver health care? He thinks he's found it, thinks he's now doing it.
Everybody has access to a family physician 24 hours a day, 7 days a week. And for those people that we can't help over the phone or over a video conference, the paramedics are in their homes that same day, making sure they have exactly what they need to stay safe and healthy. And the remainder, unfortunately, weren't able to get a hold of their family doctor, or they weren't available because it was out.
Imagining new ways to care for people at home was brewing for a while for Nolan, but kicked into action the week the pandemic was declared. He worked with tech teams, paramedics, and doctors, including Jonathan Fitzsimon, to develop VTAC, a virtual triage assessment center.
So patients call and they speak to a receptionist, and the receptionist takes their details and we see the schedule, and as soon as a patient is booked in, I call them. 12 days from our first conversation to getting approving from the Ministry of Health to going live. That's unheard of in healthcare.
Because everything is possible with money and political will. Both of those may come to an end.
Yeah, you're absolutely right. There is the risk that the funding for this ends. That tap can be turned off as quickly as it was turned on.
And so a push to understand if this works. 2,500 patients cared for this way since mid-March. The bulk of the calls from people who don't have family doctors.
I'm here at the VTAC desk, just looking to check in.
With physician shortages here, a bigger role for paramedics could offer an answer.
How you doing, man? Here, these are for you.
It certainly did for Kim and Denise Groves. Both tested positive for COVID-19, both able to recover at home, thanks in part to paramedic Matt Roussel.
Yeah, I just actually wanted to see how you're doing.
I'm doing very well, thank you.
You look a lot better.
Oh, I feel a lot better.
Yeah.
I think you saved my life.
Well, no, I was not worried. I was concerned, we'll put it that way, when I first saw you. But
well, I was concerned too, because I sure didn't feel very well.
Dropping off medication for Denise, who's still testing positive, and just checking in with Kim, now COVID-free and enormously relieved.
He did you a solid.
Oh, he did me a real solid. I think I would have kicked the bucket if he hadn't have done it, truthfully. Oh, I couldn't even get off the couch. They had to help me into the bed. I was right done. And I'm sure glad that I got an IV put in me in bed, that doesn't happen with paramedics too often when they come and give you an IV and take your blood, so it was great. I didn't have to go anywhere.
we'll be in touch, okay?
All
It's
right,
good to see you,
Matt.
Okay, take care.
Would you like to see this represent a new type of healthcare in Canada?
Yeah, absolutely. Yeah. I think it'll, it's progressing to this point now, and COVID just didn't give us, it didn't give us another chance to do something else. We didn't have a choice. We had to do this.
Other counties, other countries are now curious about duplicating the program.
To share their great ideas, to share the
Take a spin through Michael Nolan's paramedic WhatsApp group and you'll see a global ideas exchange happening at a breakneck pace. Nations further along in the COVID experience sending tips to those just starting, including advice from Spain in wrapping the inside of ambulances in plastic to make them safer and easier to disinfect. It's already put into action in Renfrew County.
It is, I think, the call to action of our generation. There is no going back. There is no sense of normal, because I don't know anybody in the healthcare system that was entirely happy with it.
But can you pull this off in a time when COVID goes away and everyone goes back to work and the roads are busy again and the schools are full?
We can absolutely continue to provide this level of service for both COVID and non-COVID patients going forward. Right? COVID will be replaced by the flu or the second wave or the third wave.
That confidence will get tested, and it's not clear how this would work in a city, but COVID has cut through the red tape, so now they leap in where needed. A last stop of the day at a seniors' residence that is so far COVID-free. The "we miss you" signs everywhere are a reminder that being safe isn't always being whole. A few more residents here need COVID swabs.
Check. Yeah. Doubles on.
The paramedics are meticulous with their PPE and again wearing cameras.
Cool. Ready? Yep.
Journalists certainly not able to head inside. In a place with no visitors, the paramedics are kind company.
Hi, Joan.
Hello.
Here's the paramedics to do.
This is Joan Walsh. She's mercifully in really good health, very much missed by her big family, and willing to come to the window for a chat.
How are you doing?
Oh, I'm doing fine. I'm an awful book reader, so I'm reading books. I've got 8 children.
Five sons in the valley and 3 daughters.
Boy, they must all want to hug you. Is there anything you want to say to your children or your family?
I tell them all the time I love them, and they tell me that too. I don't know what else to say.
That's all there is at the end of the day. It's all that matters, right?
Yeah.
There we go. Keep yourself safe, okay, Joan? I will. All right, my dear.
The little things are the big things now. Care that takes its time, paramedics who go out of their way, and people imagining that when we're all out of this, maybe we will have built something better.